What's up, everybody? Patrick LaRouche here from Evolve Restorative Therapy. You can find me at livepainfreeprocess.com. I help the super athlete and the athlete at heart eliminate pain, all through self-care, all based on the basics of healing, folks. Today, what we're going to be talking about is Achilles pain. Achilles pain plagues the running industry. If you're a runner, I guarantee you've already been through it. You've had something going on there. There's many reasons why people get Achilles pain. I'm just gonna break down the basics of it. First things first, what is the Achilles? Achilles runs through two different muscles. I'm gonna break that down. Then, what are common reasons why those muscles fall apart? That's number two. And then number three, what is one easy exercise I can do to clean it up? All right, folks? So, let's get this started. Let's look at the computer. Your Achilles is comprised of two muscles. One, your gastroc and your soleus. So your gastroc is the two big red muscles that's on top here, and your soleus is a muscle that's underneath that. That's a very important muscle all on its own. Some people call it the second heartbeat because it brings a lot of blood flow up. But they both extend the foot. They both help you bring the foot out. Helps you go on your tippy toes, so on and so forth. So you see how they both meld together? They both make the Achilles, soleus and gastroc. So if you have an Achilles issue, don't think it's just your calf muscle. It's your calf and your soleus. If you're doing a lot of calf stretching, it's not going away. Guarantee you it's the soleus. And you stretch the soleus slightly different than the way you would stretch the calf. Believe it or not, just because where it attaches on the whole big scheme of things. So that's the Achilles. Common reasons why this happens is, and let's zoom back out on me real quick. All right, so the common reasons why the Achilles, you have Achilles pain, majority of the reasons why is your ankle and your intrinsic muscles of your feet no longer work very well. Achilles issues always come and go right around like plantar fasciitis, sore feet all the time because your intrinsic muscles, this is the muscles that comprise your arch in your foot, no longer work. So what happens is they start to stretch out and start becoming hard. So you no longer have a shock absorber. That now hinders the ankle from moving. So now your Achilles and your soleus and gastroc have to work harder to extend the muscles because the joint of your whole ankle no longer wants to move because it's being your shock absorber. So the fact that your intrinsic muscles of your feet don't work, your ankle's going to stop locking up rather than being a mobile object, forcing your calf and your soleus to work harder, hence the extra fray. That's why you have Achilles issues. So what is something that you can do to clean this up is the next thing. Let's actually show you, right? All right, what we have to do now is we have to now focus on getting the Achilles and the soleus to start learning how to open. What I'm gonna show you is something called an eccentric load to the soleus and calf, AKA your Achilles. What this is an eccentric load is the opposite of what a muscle technically does on its normal day-to-day function, which is contract. A muscle consistently contracts. So what happens is on the open, that's where it wants to contract. So when you're having Achilles pain, as you start to open and close, it opens, it doesn't want to open as much, so you force it just by gravity, and that's when it shreds. You have to do a controlled, easy movement on the open. And once that happens, your body starts to reset how it's supposed to do it. So at first, you're gonna use a little bit of body weight, and then you're just gonna control the movement. So what you're gonna do is get a step stool, a stepper, or you can do this on any step whatsoever. You want to now do like you're going to do a calf raise. You're gonna go up, leave a foot off, and then you wanna hold for a second. Get that calf to start wanting to open up, and you're gonna feel it contracting. And then slowly, on a 10-second count, let's say, bring it down. Just like so. So you're bringing the whole calf down. What happens is it starts to stretch all the way throughout the whole calf. And the calf should be a different type of stretch. So you want to open up, like let it out, go to your calf raise, hold the calf raise, and then drop it down nice and slow. Give it a 7 to 10 second route. And then once you're in the stretch, in that way, you want to now let it stretch, let it open. So teach it how to reopen again. And this is not a short-term thing. This is not 3 or 4 stretches and you're going. You're going to have to do this for a good, 10 times for a week, 2 weeks before you start really seeing some results on changing that habit. So it's going to be very important for you to be patient with this because you're reconditioning a habit. Now, this is the bigger key to it. If you're having Achilles issues, you're having ankle issues and intrinsic muscle issues. One concept. It could be something that's triggering up top the chain, a knee issue or a hip issue. But you want to understand you have a movement pattern issue. So it's not just about just this one exercise. It's about the movement pattern that you're doing as well. Are you, for instance, a heel striker when you run? All those different things can cause this, like heel striking or just a tippy toe runner. There's just pros and cons of running styles. There's not one perfect running style. There's pros and cons to both of them. Heel striking, you're gonna compress a lot of joints because you're putting a lot of weight load on it. Balls of the feet runner, you're gonna compress your calves like crazy, as well as you're not utilizing the intrinsic muscles as well. Midfoot runner is the safest zone for people to be in. That's why they say you want to be a midfoot runner. But if you don't have the hip integrity, you're never going to be that. You're either going to be a toe runner or a heel runner. You have to have the hip integrity, ankle integrity to have an easy flow within the lower body. So folks, that was the basics of Achilles pain. If you guys have any questions, please hit me up. Keep it coming. I love the fact that you guys are giving me so much. Until next time, folks. Bye.